Okay, we're back in business. So today I'm going to just go through some challenges that we go through as dentists or implant dentists, our everyday work in both aesthetic and function. As you can see, my lecture is absolutely almost to the word same with Ben. But I'm going to show you something that's different. You know, we didn't talk about this. Suddenly the submission went through when the editorial committee had a look at it and say, hey, why not? You know, try to find a common topic and give a completely different lectures. Okay, so, all right. So basically the challenges that we get today is to look into the aesthetic challenge in terms of both in terms of practicality, the immediate challenge after implantation, and the long-term aesthetic challenge. Okay, so these are the aesthetic challenges that we get. That means that when the patient gets the implant immediately, what are we going to give them as an aesthetic replacement for whatever they've lost, and also to look at the long-term aesthetic. The second is a function. Yeah? Function means that immediately after the implantation, after you place the implant, how are we going to have them eat again, smile again, speak again? So those are the things that we look into. Okay? So the immediate aesthetic challenge to me is how to do the provisional restoration. Should we use a temporary bridge or a temporary denture? And these are the things that's very important to patients because they have to face the society again. When they walk up to our door, they must not look like they are dental cripples. They must look like they've had some sort of a decent makeover. All right. So when we have a look at a case like this, when a patient comes into our clinic with one or two teeth left, with a partial denture which is wobbling, so we need to do something about this patient. So in this case, we decided that we wanted to do a full restoration for him, and that's what we did. We removed his remaining 4 teeth, and we placed a total of 6 implants in the lower arch. And the color's not that good. Okay? I hope you can see on that slide, maybe because of my background is not so good. But you can see that we've taken out the teeth, and we have to do some sort of replacement. And in this case, we use a lined soft liner on a full denture. So the problem with the denture is that there are advantages. The advantage would be it's able, we can remove the denture, we can do some inspection on it, and it's easy to clean by the patient. But the disadvantage is there as well, because we can see that the disadvantage would be the aesthetic in terms of being a denture. Patient goes home, they probably talk to their spouse or their family that they're having implants. But what happens to them? They come back with flippers or dentures. So these are the expectations that we must look into. Okay. In terms of provisional crowns, can we use provisional crowns for our patient? Possibly we can. We can use resin crowns to immediately restore a newly placed implant. In all cases, maybe not. But I can show you 1 or 2 cases that traditionally I would have used a denture, but today I can confidently place an implant and then send them away with something that is already fixed. Okay. The case I'm referring to is a post-trauma case of a patient who had a trauma a couple of years ago with pan-facial fracture, and I then decided to use immediately loaded implants on her lower arch. Okay, she is a 23-year-old female who had a facial trauma at the age of 17. She was on a motorbike, and she fell off a motorbike, and she had a 4-tooth fracture, a mandibular fracture, and loss of lower and anterior incisors, as well as loss of upper anterior teeth. And upon examination, we find that she's basically not just lost teeth, but she's also lost a lot of depth out of the bone. Then we send the patient back to our prosthodontic colleagues, and they set up a basically wax up of what we should do. So we propose that we would replace and restore 2 missing teeth on the lower arch, to do away with the dentures on the lower arch and place immediately fixed prosthesis. Okay? So on the day, we had this in line. On a closer view, we find that there is a very thin alveolar bone with loss of those lower anterior incisors. Okay, so we then open a flap because it's very thin. We decided to open a flap, and in this case, we wanted to use something that is quite straightforward, and I decided to use a one-piece implant in restoring this case. And that's what we did. Okay, we open a flap, and we use a twist drill, the appropriate length and depth. Okay, in this case, we use a 3.3 millimeter and 12 millimeter novella implant that will place into the alveolus. Okay, and that's how it looks like. Sorry, the pictures are not so good on that. Different from here. Anyway, that's what we did. We placed the teeth into place, and then we sutured up. In this case, the mandible was assessed, and then we used a diamond burr to actually trim the abutment on site, and then we used a template that we made before with the impression. Can we get the contrast right? Or maybe I should use a different background, yeah?
Yeah.
Try to change the background again. Teeth. Right. Black.
Black.
It's not good.
Yeah.
Yeah, it's even worse. Breakfast? No?
Breakfast.
That's increase. That's the best you can do.
Maximum.
Maximum. Try the contrast. Yeah.
Okay.
It's much smaller. Okay. All right. Okay. So that's as you can see, I used the template that we made from our wax up, and then we then used resin for crown construction, a Pro-Tem 4 is my material of choice, and then we made immediately after setting, we trimmed it. Okay, don't ask us oral surgeon to do, that's what's happened, you know. So hopefully the prosthodontics can work better for me, okay? But the patient goes home with some sort of tooth, yeah? That means she goes home with teeth, and she doesn't have the dentures anymore, at least on the low. So we're working on some work on the upper. I'm sure you know the dentist can do better job than that. Yeah. Okay. That's why there's a joke. You know, if you can't do dentures well, can't trim a crown, can't do fissure sealing well, become an oromaxillofacial surgeon. Okay. Okay. So the advantage of that is that aesthetic as well as functionally pleasing. The disadvantage is that it's difficult to clean, it's harder to inspect as the implants are not accessible to you, and immediate loading may destabilize the implant if primary stability is compromised. And those are the things that you have to plan, as I say. Plan the end in mind and get that sorted out. Okay, I've got another case here. This is case number 2 is a diplomat who has lost all his upper teeth. He had the implants before, so we placed some implants for him, the conventional implants. But he said, doctor, you know, when you place those implants for me, I have to wear dentures, I have to endure that. I go to social parties, I have to entertain people, corporate people. So can you do something for me that is better in terms of provision? Because he doesn't want to go out anymore with dentures. So this guy, I said to him, okay, we'll have a look at it. We have this new implant that we made in Malaysia. Maybe we can try this on for you. Okay, so an immediate fixed provisional restoration option was on the cards. So in this case, this 62-year-old male, the diplomat, who lost 4-unit bridge 6 weeks before, he came to us initially having one implant and then the next, because he had a full fixed bridge for both upper and lower when he was in Germany, in Turkey. He did all these restorations in the 1980s. They have lasted for 15, 20 years, but after a while, they all have, one by one, the bridges have come, especially the upper. The lower, we've managed to rescue most of the bridge, but on the top, it's all going to implants. Right? So on the left, you can see there, we have a laser pointer again. Yeah. You can see that. These are the conventional implants that he had already with us. He had another one here, and then we placed a one-piece implant on the front. They're still with a temporary restoration there. So, and he said, okay, he wanted more of the same, where he doesn't have to wear any dentures, and we proceeded in doing the same thing. We waxed up 5 teeth there, but we planned to do only 4 implants. We overbuilt it a little bit. We've taken the impression on the model. We then place where initially we want to place the implant using a high-speed diamond burr on the surgical face. Once we've identified where we want to place the implant, then we then abrade the mucosa until we can see some periosteum. Clean the periosteum where we want to place the implant. Use a 2.2mm twist drill. Align where we think that we are to place the implant. This is the Novella implant. We place the implant one at a time. We make sure that it's carefully aligned. 4 was placed. Okay, so quite satisfied with the 4. And then we use the template that we did on the wax up. And then we put in the Pro Tem 4. Note that there's a little bit of under coverage there. What we do then is that we then add on a little bit of composite on top of it. We use blue light to cure the composite, and 1 hour and 30 minutes later, the patient goes home with complete sets of implant, immediately loaded, or immediate provisionalization, as I would like to say, rather than immediately loaded. The patient goes home with teeth, no scarring, no scalpel, no bleeding, no pain. Because the beauty of having a flapless surgery is that you don't raise periosteum. When you don't raise periosteum, the patient doesn't feel any pain. Okay? Okay, the third one was a patient who is a socialite with no lower teeth. Patient is not a patient that I've not, this is a long-term patient. Patient's been with me for the last 5 to 6 years. She is a 73-year-old female, recently made edentulous. I was away overseas. She then went to a government hospital, and the consultant there said to her, look, your lower teeth, she's only got like 4 lower teeth left, and she said, okay, what can you do for me? The government consultant said, it's best that we remove the teeth and give you dentures. And then she then followed the advice of the consultant, and the teeth were immediately extracted, immediately restored with dentures, immediate dentures.